It's very distressing that this has to happen here in America, but we're doing the best we can to provide a little bit of service for you folks and our own folks that don't have any.
Healthcare in the United States is really the privilege of the well-to-do and the well-insured. We know that we've got the best healthcare potential and availability if you can afford it. Now this is important, folks. We're very glad that you're here, and it's going to be a long wait, but this is your ticket to get in the morning. I'm assuming that you're all going to stay here tonight.
There's so many people that need health care and don't have insurance. We don't have I or anything like that, so I have no problem camping out 2 days, 3 days to try to get some very needed care that I need.
Okay, we're about to get started here.
Okay, who's got number 1?
Who's got number 3? Who's got number 4? 57, welcome aboard, ma'am. 57, 58, 59, 60.
Well, these are patients who really fall through the cracks. They're folks that are hardworking but don't have health insurance and have lots of medical needs. It's amazing to see, 1,500 people in a day lining up to get health care, maybe the only time that they get health care at any time during the year, simply because they don't have access to medical care, often because they don't have the money or health insurance to provide it. And it's really an indictment of the whole healthcare system that we have to have this year after year because we can't seem to get the resources together to help everyone have access to health care.
We came 2.5 hours for vision, basically, and then whatever else we can get done. I worked over 30 years, have a couple bulging discs in my back, got out of work and lost my insurance.
The cost of the dental care for your normal patient is so extreme. To be able to get a tooth pulled is like $90 to $100. Like, people just don't have that money. And especially with the rising cost of fuel, the rising cost of food, just to make ends meet and actually live is getting so ridiculous. In healthcare is on the back of their mind, What's on the top of their mind is, how am I going to feed my kids? How am I going to feed myself? And how am I going to get to work? We've had patients to tell us that. I have to choose between food and medicine, and I have to eat.
593, 594, 595, 596, 646, 647, 648. If you have a number that's over 700, you're going to be waiting for several hours today. There is a possibility that you will not be seen today.
Well, we're prepared to wait all day because this is a once in a year effort to get our eyes and teeth worked on. So we just have to sit and wait as long as we possibly can.
I have to pay out of my pocket if I have to have any medication, so it can be expensive, very expensive. You have to save and save and save, and so it's really hard. It's really hard to make it.
and they just can't take another. There are a lot of people who've been waiting inside who are not going to get their teeth cleaned either. I'm having to turn those people loose as well. So
We took a chance.
I appreciate you being here, and thanks for your patience.
Okay, thank you.
We're supposedly one of the richest countries in the world, but yet we can't take care of our own people.